Chief Sriratana Project Advisor with the National Research Council of Thailand and former Deputy Permanent Secretary of the Ministry of Natural Resources and Environment of Thailand, serving as seminar moderator today. The United Nations Agenda 2030 and the Sustainable Development Goals, SDGs in short, represent an urgent call to action in a global partnership to end poverty, protect the planet, and ensure that everyone enjoys peace and prosperity. The Biocircular Green Economy model of BCG is a strategy of Thailand to drive the country's economic and social development while promoting environmental sustainability. It is an integration of bioeconomy, circular economy, and green economy. Bioeconomy involves the production of renewable biological resources and conversion of these resources into value-added products. Circular economy aims to reusing and recycling resources. Green economy aims to keep economy, society, and environment in balance, leading to sustainable development. To open the event, we have honor to have message from two key organizations that have made this seminar series possible. So may I call on Dr. Viparat Diong, Executive Director of the National Research Council of Thailand, or NRCT, to deliver her welcome message. Dr. Viparat, please.
It's my great pleasure and honor to deliver opening remarks for the seminar series on Thailand Biocircular Green Economy Model, awareness raising, capacity building, and international perspectives in its second seminar on BCG economy model in the health and well-being sector. I'm deeply grateful to the partner organization of the National Research Council of Thailand, namely Mahidol University, in collaboration with the United Nations Resident Coordinator's Office in Thailand, National Science and Technology Development Agency, Office of the National Economic and Social Development Council, Ministry of Foreign Affairs, and the ASEAN Institute of Technology. I thank all speakers and moderators and their respective organizations for their contribution in making this seminar possible. NRCT is the principal organization in Thailand, which guides the development of country and public policy by using research, including the integration and the administration of national research budget, leading up to the concrete utilization. NRCT administers research work with professional standards by using moral principles to reach achievement. NRCT employs these values and principles in its delivery of research and development program in alignment with UN Agenda 2030 and the Sustainable Development Goal or SDG, including the implementation of the Biocircular Green Economy model in the country. The Royal Thai government has sponsored a number of events to introduce the BCG economy model to Thailand private sector, government officials, and other stakeholders. This seminar series will build on these events by sponsoring discussion between Thai and international experts on the BCG economy model, its intended impacts, and how experience, both domestic and international, may have lessons for BCG as implementation moves forward in the country. The BCG economy model represents a strategy to drive the country's economic and social development. As such, is expected to provide further impetus for the implementation of the Sustainable Development Goal. In addition, The BCG economy model is expected to be a focus of discussion the 2022 Asia Pacific Economy Cooperation Ministerial Meeting chaired by Thailand. I'm confident that the outcome of this second seminar of the theme of health and well-being as well as its subsequent seminar on other important key sectors of Thailand will be valuable in running the status of BCG economy model implementation in the country. Again, I thank all partner organizations and stakeholders, and I wish the seminar well. Thank you.
Thank you, Dr. Vipalati Ong. May I call on Ms. Gita Saprawal, United Nations Resident Coordinator for Thailand, to deliver an opening message, please. Ms. Gita Saprawal, please.
Swadika, Dr. Mantip, distinguished participants, colleagues, and friends. Thank you for the opportunity to share my views on health and well-being through a biocircular green perspective. The government's commitment to scaling up this ambitious development dialogue in various domains is very much aligned with the SDGs. In fact, the goals of the BCG underpin the UN's 5-year cooperation framework, which sets out the priorities of the UN agencies, including the WHO in Thailand. The UN brings integrated technical expertise, science-based evidence, and digital solutions to bear on its policy recommendations and in-country projects. This is how we, the UN, adds value in Thailand. Let me highlight 3 areas where the UN, in partnership with the government, is lending support to green biocircularity in the context of the health and well-being sector in country. First, the UN is partnering with the Ministry of Public Health on telemedicine initiatives in this era of the new normal. One project was piloted at the height of the pandemic in Patani, where patients with lower risk of serious diseases could access medical consultations using telecommunication tools. Hospitals then delivered these medicines through the village health volunteers. This initiative is being scaled up to other provinces. Telemedicine services like these ease the burden on medical facilities, help maintain social distancing, and are more environmentally sustainable. In another similar initiative, the WHO is working with Chiang Mai University to improve hypertension management within primary healthcare facilities in Lampang province. Doctors, nurses, and pharmacists are collaborating with village health volunteers to provide basic treatment and lifestyle counseling, which is done remotely to people with high blood pressure. This makes a big difference in villages where regular access is lacking and is easily scalable across provinces. As you're aware, hypertension is a growing problem in Thailand, with at least 13 million adults suffering from it. Similarly, cardiovascular diseases is the leading cause of mortality in country. They also exact an enormous economic price, with analysis suggesting costing up to 1.6 trillion baht annually, or equivalent to nearly 1/10 of the GDP. At the same time, the rising cost of NCD-related treatments also could threaten the future of Thailand's universal health coverage system, as they already consume a significant portion of its budget. Second, we are using science-based evidence to better understand the sources of air pollution, which can cause or worsen all manners of diseases. And I know Dr. Hassan is going to speak more to this in the following session. The UN leverages its regional assets through ESCAP to access satellite imagery and undertake chemical fingerprinting of smoke. This enables us to understand in real time the exact sources of air pollution, its levels of toxicity, and health impacts. We learned that the most harmful pollution in Thai cities is caused by smoke from seasonal biomass burning and industrial emissions. analysis suggests that air pollution impacts women more than men, with a statistically higher rate of illness, deaths, and pregnancy-related complications. This is a pressing health concern, and the UN is taking this partnership to support 10 provinces to develop strategies to reduce airborne pollutions. Finally, we are prioritizing waste management assessments to support the recycling, reuse, and safe disposal of hazardous waste at the municipal level. Tackling this problem is part of a broader waste management challenge. UNEP, UN Habitat, and UNIDO are piloting these assessments across 20 municipal landfills and dump sites to devise biocircular solutions. Among the solutions will be those targeted at hazardous medical and chemical waste, which can negatively impact people's well-being and the immediate environment. Going forward, the UN will be deploying other evidence-based strategies and digital solutions to assist Thailand in its biocircular green transformation. I'm very much looking forward to the Deputy Prime Minister and Health Minister's keynote address and to the panel discussion by other distinguished experts here today on the opportunities and challenges ahead. Thank you very much, and Khap Khun Ka.
Thank you, Dr. Vikarationg and Ms. Gita Saprawal for delivering cordial welcome and inspiring opening messages. So next, we are fortunate to have presentations by distinguished authorities and experts in the health and well-being sector. I have honor to call on our distinguished keynote speaker, none other than His Excellency, Mr. Anutin Charnvirakul, who is currently Deputy Prime Minister and Minister of Public Health of Thailand. Minister Anutin has an outstanding political and business careers. He has been Minister of Public Health since July 2019 and formerly served as Deputy Minister of Commerce. He is a leader ofภูมิใจไทยpolitical party, serving as the Minister of Public Health. He brings to the position over 25 years of experience in business development and organizational management. Minister Anutin will speak on bio-circular green economy model in the health and well-being sector. Due to his busy schedule, Minister Anutin is unable to be with us live, but he has kindly provided us a video recording of his presentation. His Excellency, Minister Anutin, please.
Colleagues, participants, ladies and gentlemen, it is a great pleasure of mine and honor to deliver the keynote speech at the second seminar of Thailand's Bio-Circular Green Economy Model in Health and Well-being sector today. This seminar is important, timely, and relevant. The BCG is a new economic model which underpins inclusive and sustainable growth in Thailand, seizing an opportunity as we recover from COVID. The BCG model, through a whole-of-society approach, aims to efficiently use natural assets while minimizing negative impacts on the environment. Collectively, all government sectors, private sector, and academia can bring Thailand back on track towards a healthier, greener, and more inclusive economy as the pandemic gradually subsides. This model not only conforms with the UN Sustainable Development Goals, it aligns with the sufficiency economy philosophy initiated by King Rama IX and guides the principle of Thailand's social and economic development. The BCG addresses climate changes, protects the environment, safeguards biodiversity, and minimizes the risk of emerging infectious diseases. Thailand aims to reduce the consumption of natural resources and to reduce pollution and environmental impact from development Another of Thailand's policy is to lessen the use of plastic and increase recycling and use of biodegradable materials. We also commit to minimizing food waste and its greenhouse gas emissions, moving us towards a low-carbon society. The Ministry of Public Health and other agencies in health sector apply BCG principles in their works. Thailand's health systems have been well recognized worldwide in 2021 Global Health Security Index. Thailand ranked first in Asia and ranked fifth globally, just following the US, Australia, Finland, and Canada. However, one of our key health systems challenges is reliance on imported medicines, both finished and products, and raw materials for local manufacturing, medical supplies and equipment. The BCG presents an opportunity to drive domestic economic growth of the health sector. Thailand Board of Investment has offered 8-year exemptions on corporate income tax for medical industries, which will stimulate local production while reducing the import of medicines, vaccines, and medical supplies. Local production requires investment in clinical research and development, infrastructure and human resources, and needs to be supported by efficient registration of medical products. There is a great opportunity for manufacturing medical devices and supplies, as we have more than 1,500 medical device manufacturers, mostly joint venture SMEs with foreign partners. With an annual export value of $3 billion, Thailand is the largest medical device market in ASEAN, with 10% annual growth against the world's average of 5%. Majority of export products are medical supplies such as alcohol for medical use and other personal protective equipment. Health policies also support the use of locally generated genetic data. Genomics Thailand enables the R&D on precision medicines for disease prevention and treatment by taking into account an individual's genetic variations. There are advancements in manufacturing of herbal medicines derived from cannabis and hemp for medical use. People in Thailand can now grow cannabis plants at home and sell their crops. Thailand is the first country in Southeast Asia to advance legalized trade and medical use of cannabis. Nonetheless, the government heavily discourages recreational use. Ladies and gentlemen, I want to highlight 3 concrete examples of BCG in action. First, on the COVID vaccine. As the chair of the board of National Vaccine Committee, I admire the National Vaccine Institute for its effort in leveling up the vaccine portfolios at domestic and international levels. Through NVI, Thailand is the lead country working together with ASEAN member states for vaccine security. In 2019, when we chaired the ASEAN Summit, the ASEAN Leader Declaration on Vaccine Security and Self-Reliance was adopted and translated into real actions by all Thai partners. The Royal Thai government provided financial support through NVI to various public and private research institutes in Thailand for research and development of more than 20 types of COVID vaccines. Currently, 4 platforms have demonstrated significant progress of R&D in human trials. The inactivated vaccine by the Government Pharmaceutical Organization, or GPO, and Mahidol University, and the mRNA vaccine by Chulalongkorn University and Thai Red Cross. And last, protein subunit vaccine by Chulalongkorn Innovation Hub by Ya Phytofarm. That includes also DNA vaccine by Bionet Asia. These R&D efforts get support from international partners such as Program for Appropriate Technology in Health, Bill and Melinda Gates Foundation, and various universities. It is expected that a product will be registered and manufactured locally by next year. Apart from R&D, Siam Bioscience is a contract manufacturer organization of AstraZeneca. Through transfer of technology and know-how, SBS has produced and distributed more than 200 million doses of viral vector COVID vaccine to countries in and outside Southeast Asia, including Thailand itself. SBS is not only capable to manufacturing the viral vector vaccine, but also other medical products for the region. These strategic movements through public and private partnership ensures vaccine security and progress towards self-reliance. Importantly, this allows the Thai government to offer COVID vaccines to everyone in Thailand, including foreigners and migrant workers, all free of charge. Second, on Thai USC and the use of locally manufactured medical products. As you know, the UC scheme was launched 20 years ago. It has improved access to health services and provided financial protection for all Thai people, and recently for non-Thai population in case of COVID. The scheme offers a comprehensive benefit package for its members, including new medicines and even high-cost technology subject to a rigorous review on cost effectiveness, equity, health systems readiness, and budget impact. As the chair of the National Health Security Board, which recently approved the procurement of dental implants for patients in need, and initial 7,000 sets that were locally produced. The product was registered in the Thailand Innovation List, which improves access to dental health at lower cost and strengthens our local medical industry through the BCG model. Third, on green health facility. Public and private hospitals have established safe disposal methods for medical waste and safe reuse of medical devices. The pilot project of public hospitals using the clean energy of solar roof shows significant cost saving from harnessing solar energy. The solar roof at Ramathibodi Jakki Narubadin campus totally replaces electricity and is one of the advanced BCG models. The Ministry of Public Health Policy on medical hubs is another concrete BCG model. The Andaman Wellness Corridor, which covers high potential southern provinces such as Phuket, Krabi, Trang, Phang and Ranong, can provide medical tourism and green wellness and spa. This issue may be elaborated in the fourth seminar on BCG model and tourism. This year, the Ministry of Public Health hosts APEC on health during August 22nd to 26th. This seminar is one of the great inputs for the APEC high-level meeting on health. Also, Thailand, through the Ministry of Public Health, is the main financial contributor and the secretariat of the annual Prince Mahidol Award Conference. The theme for PMAC 2023 next year in January is setting a new health agenda at the nexus of climate change, environment and biodiversity. It offers a unique opportunity to address the triple planetary crisis causing global health burdens on people. Finally, under my leadership, Thailand is well entrusted to host Expo 2028 in Phuket under the theme of Future of Life, living in harmony, sharing prosperity between March and June that year. I cordially invite you to join the 2022 APEC meetings, the 2023 Prince Mahidol Award Conference, as well as other future events arranged in Thailand for continued discourse in implementing the BCG model. Thank you very much and have a good day.
Thank you, Minister Anutin Chanvirakul, for providing us an overview of BCG economy model and its linkage with health and well-being sector, and for sharing how the health sector can contribute to and benefit from the BCG model, presenting 3 concrete examples of BCG in action. Firstly, on vaccine, in particular the COVID vaccines in Thailand. Secondly, on the universal health coverage scheme in Thailand. And thirdly, on green hospitals. It is an excellent keynote to the presentations and discussions that follows next. So our next speaker is Dr. Mohammad Nasser Hassan, Regional Advisor in Air Pollution, Environmental Health, and Chemical Safety, World Health Organization's WHO, New Delhi. Dr. Hassan is an academic and researcher in environmental science, environmental systems, and environmental economics. He held several positions at WHO, including, among others, as Senior Environmental Health Advisor for Cambodia, Laos PDR, especially WHO Cambodia, as team leader on environmental health, and served as team leader environmental health and as coordinator health and the environment at the WHO Western Pacific Regional Office in Manila, the Philippines. Dr. Hassan will speak on learning the experience from COVID-19 and innovative, healthy, green, and sustainable recovery efforts in the health sectors. Dr. Hassan, you have the floor, please.
Thank you, Dr. Montip, and it's nice to meet you again. We have met a couple of times, but if you were to recall, I think I met you during the regional forum on the health and the environment that was held many years ago. Thailand was the chair of the regional forum. It's also a great honor to meet the Dr. Miss Gita Umparat, and then His Excellency Dr. Anutin, Mr. Anutin. Thank you. Now, I will be focusing on the path to healthy and sustainable recovery with regard to COVID-19, but then I will also touch various aspects as well about moving to a climate resilient system or health systems. And then I'm coming here to probably share my thought and experience, and probably we can debate and discuss this further. Next, please. We know that when come to COVID-19, and not only COVID-19, but the pandemic itself, in the past, we have learned that the Earth has very strong link between the Earth and the habitats and the people. So there is a proverb saying that the moment you disturb the Earth and you disturb the habitat, you expect very unexpected things like COVID-19, which we have never experienced in whoever probably live up to this age in the past many years. So COVID-19 has been affecting the entire world. Even if you see the case here, even confirmed or whatever, even the death, it's not only the number, it's the people. is the people who have suffered and who have died because of the COVID-19. And not only that, many sectors has affected. Those who are poor and living in the poor environment, having COVID-19 become worse, exacerbate the social injustice, vulnerabilities, and tremendous stress, not only to the economy, but also to the health sector or the health system, from the primary level to secondary to even to tertiary. Unprecedented. Whenever you are, whether in developed or especially in developing countries, this COVID-19 has huge impacts to the people and the health. Next, please. Climate change makes things worse, worsens the vulnerability. Everyone has seen the 6th assessment report of the IPCC. And the 6th assessment report, as what the UN Secretary General could read to humanity, I found out that climate change has unprecedented and potentially irreversible damage. And not only affecting the habitat, not only affecting the earth, but also the people themselves. You can see from the picture, not only this picture, but you have seen this in many countries, how climate change has impacted the people and the economy. The past 5 years has been the hottest. Recent date of sea level rise has nearly tripled compared to the previous century. Virtually certain that hot extremes, including heat waves, has become more frequent, more intense since the 1950s, as what we have seen with regard to the heat waves in Europe, flooding, and so on and so forth. So climate change has worsened the vulnerability, not only related to COVID-19, but other extreme situation, and make things the situation becoming worsen. Next, please. So, and no one has been spared due to climate change. All regions, all countries, big or small, are affected by the rising temperature, especially in the northern hemisphere. And you can see that in various publication that has been published, chapter 1, and then chapter 2, and then also chapter 3 of the IPCC. The working group 1, working group 2, and also working group 3 predicted that this is affecting everywhere and everyone. Next, please. So at the COP26, WHO has come up with the argument, special report on climate change and health. There are various perspectives that you want this whole issue is about a zero carbon, resilient and inclusive global economy to put forward the health as the center of discussion in climate change work. The first two, commit to healthy recovery and build health resilient to climate risk. These are the two most important aspects of the health argument that we want to put forward to COP26. Next, please. Next, please. So when we talk about building climate resilient, there are two aspects that we are talking here. One is about the fact that how can the health sector build the adaptation to various risks and hazards caused by climate change and environmental degradation. This is called adaptation. Adapt to the health system adaptation, to sea level rise, to vector-borne program, to flood, to many other unexpected outcomes at the global level. The second one is that how can the health sector themselves contribute toward carbon reduction? I know that you may be asking that compared to the transport or the energy sector, maybe you say that the health sector contribute insignificantly. But then we are talking about how can the health sector themselves contribute toward carbon emission reduction. And this is called mitigation. Next, please. The healthy recovery from COVID-19, there is a manifesto, and you can get access to this manifesto in the WHO website. This is about 6 measures. This is to protect and preserve the source of human health, the nature themselves. As we have already highlighted, there's a very close and delicate relationship between nature, the environment, the planets, and the health, whether directly or indirectly. The second one is about invest in essential services in the health sector, invest in water and sanitation, to clean energy in the healthcare facilities. And then number 3 is ensure a quick and healthy energy transition. We don't want the health sector to contribute towards a carbon intensive. We want to have the health sector gradually contribute toward carbon friendly or even carbon neutral systems in the next few years. We want to promote healthy and sustainable food system to make sure that not only the nutrition will be improved, but also sustained. Because as we have found out that climate change has huge impacts on the food security and the food systems. I can elaborate further on this. And then the fact that we have to build healthy and livable cities. Very close cooperation and collaboration with mayors of cities, not only by the health sector, but also with the head of cities, the mayors, the governors, and so on and so forth. And stop using taxpayers' money to fund pollution. Next, please. Recently also, WHO has come up with the guidelines on what we call as climate resilient and environmentally sustainable healthcare facilities, to make sure that the healthcare facilities are climate resilient, to protect and improve the health of their communities in an unstable and changing climate, while optimizing the use of resources and minimizing the release of waste by becoming environmentally sustainable. Next, please. What are they? You're talking about in the next generation, right from the minister down to the administrator, down to the nurses working in the health sector, are having the new mindset in terms of climate change, in terms of environmental sustainability, building health workforce that has embedded with them with climate resilient, climate adaptation, and environmentally sustainable perspective. Making sure that healthcare facilities have access to water, sanitation, basic hygiene, and healthcare waste management. Making sure that healthcare facilities not only have electricity, but in the short and lower terms, transitions toward energy-friendly systems and infrastructure, technologies, and products that support for environmentally sustainable healthcare facilities. 4 elements of what we call as CRASH. Next, please. Wash is essential. Water sanitation. Sometimes we have too much water, too little. So we are talking about provision of wash is individuals, and then not only individuals, but communities. But how can we think about nowadays where hospital and healthcare facilities do not have water? We want to make sure that the SDG target, that 100% of water of healthcare facilities have basic wash, and not only in terms of quantity of water, but also quality of water. making sure that managing waste is not only reduced, waste is reduced, turning into non-burning system. Healthcare facilities cannot contribute toward carbon-intensive medical waste systems. And then as much as possible to reduce the disposal, the final disposal. Next, please. Greenhouse emission from building and transport in healthcare facilities. We know that heating, ventilation, and conditioning contribute a huge amount of energy. Water heating and cooking contribute 18%. Operation of medical and office equipment, 9 to 16%. Lighting contribute to 8 to 11%. And transport contribute to another around 10%. All healthcare facilities must undertake energy auditing or carbon auditing to make sure that we know where we are and how much we can contribute toward carbon friendly in the next few years. Next, please. There are many innovative practices to reduce greenhouse emission. This is the mitigation part. I don't have to elaborate. There are measures to reduce electricity, innovative idea to low carbon energy reduction, reduce greenhouse emission from gas and coal usage, beyond mitigation, and this is about having innovative ideas as well. Next, please. There are many healthcare facilities that has introduced innovative ideas about building solar panels on top of hospital that can run the hospital operation for even 24 hours a day, and these are relatively cheap and highly competitive now in terms not only in terms of technical but also in terms of economic competitiveness. Next, please. When I was in Fiji, I took a boat. These are small island countries. Nowadays, boats has installed a very smart way of using solar panel. You can see from the right there, there's a solar panel that can generate electricity and store in the battery. There is an inverter that convert the electricity that produce light, and also the the system that the boat itself, a very small boat that can be connected to internet and getting the system, the weather patterns, and so on and so forth. This is very innovative way of moving forward. Next, please. Architecture is never neutral. It helps or it hurts. Many healthcare facilities, hospital now has green systems in their hospital. We have new and young architects, designers that can bring environment into the healthcare system to make sure that not only the hospital, this is not about treating the sick, but it's also bringing the well-being, the mental health, and so on and so forth in the healthcare facilities. Next, please. Designing for water, designing for air. So beyond mitigation, build climate resilient healthcare facilities. And we encourage architects, we encourage designers, we encourage young people to contribute toward building healthcare facilities that are green and future healthcare facilities. One or two final slide. Yes, next please. So in conclusion, COVID-19 has highlighted the close relationship between the health of people, the health of the planet, and further exacerbated existing social injustice and vulnerabilities in our communities and in our health system. The pandemic has also provided an opportunity for building forward better, greener, and more equitable. Taking rapid and ambitious action to halt and reverse the climate crisis has the potential to bring many benefits, including for health. So all people working on the climate change can bring health directly or indirectly. They call it health co-benefits. In building back better, it's important for us to go back to basic, making sure that water and sanitation, energy, vulnerability of infrastructure to climate change impacts. Innovation is very crucial here. My final slide here, next one, is the message of the WHO Director General. In any effort to make our world safer are doomed to fail unless they address the critical interface between people and pathogens and existential threat of climate change. that is making our Earth less habitable. So thank you very much, Dr. Montip and colleagues and friends. My apology if I have taken a bit of time here in my presentation. Thank you.
Thank you, Dr. Hassan, for sharing learning experiences from the COVID-19 pandemic in regarding to sustainable recovery efforts in the health sectors. Dr. Hassan underscored the close relationship between the health of people and the health of the planet as lessons learned from COVID-19 pandemic while facing the effect of the climate change. So the next speaker is Mr. Montian Buntan, who is currently a senator of the upper house of the Parliament of Thailand and a former member of the United Nations Committee on the Rights of Persons with Disabilities. Senator Montian Buntan started a teaching career and then became a social activist holding a number of positions within the organized bride movement in Thailand, serving in the Senior Advisory Council of Thailand, Association of the Blind. He contributed to the development of the United Nations Convention on the Rights of Persons with Disabilities. Senator Muntian will speak on Disability Inclusive BCG Economy Model, Challenges and Opportunities to the Health and Wellbeing sector in Thailand. Senator Montian, you have the floor, please.
Thank you very much, Dr. Montip. A very good afternoon to all participants, ladies and gentlemen. First of all, it is a great honor for me to be invited by the organizer of this seminar to speak in this historic event. I never claimed to have any expertise in this area. When it comes to BCG economy model, I have had little, if not no experience in the field. However, when I was asked to deliver this presentation, I'm moving back to my repeating campaign on inclusion in all aspects of life. So I take this opportunity to present my argument and my proposal to the use of BCG as a driving force for development in the future for Thailand and perhaps many countries in the region. When talking about disability, several people think of disability merely as a health issue. It is right or wrong. Disability could be caused by health-related conditions, such as impairment, which is an important part of disability. The medical field treats disability as a consequence or result of impairment, which is long-term or permanent. Such impairment has direct impact upon the human functionality and restrict his or her ability to live independently or to contribute to the society as productive citizens. So traditionally, persons with disabilities are expected to live passively, wait, and live through kind assistance or charitable help. Persons with disabilities are never expected to contribute to well-being, growth, and development of the society. However, as we are moving towards a more social and human rights approach, persons with disabilities have been defined or have proclaimed ourselves differently from what we used to be defined. Disability itself is an interaction between individual characteristic, so-called impairment, and the environment, which could hinder the full and effective participation in the society. Oftenly, such environment could create barriers which could worsen the situation. So in this case, disability is not an individual pathological phenomenon, but an interaction between the individual character and the social construct. This presentation is trying to examine how the BCG, together with the concept of inclusive equality, could be both a challenge and opportunity to the health and well-being sector within the society, especially Thailand. My observation is that the BCG seeks to maximize the use of resources we have, whether it's human resource, it's natural resource, through biodiversity, through sustainable environment, and through the maximum utilization of human capacity, we can move forward and live in a sustainable future. Again, when we go back to a conventional medical model of disability, persons with disabilities will not contribute at all, whether we use whatever model of economy to drive the society. But let's look at this inclusive model or disability inclusive BCG economy model. The BCG, under this approach, will have to eloquently and clearly be open, engage, and involve for full and effective participation of the people, no matter how disabled, how restricted, how limited they are. And I look at the disability from a very large scope or large spectrum, which means that we have no one to waste in this economy model. We have to find ways to create an open environment for participation so that they can contribute. The BCG should also remove and reduce barriers and create enabling environment so as to ensure universal access to goods and services. And let me explain this. We've been talking about sustainable environment. We've been talking about the natural keeping harmony with the nature. Do not create any harmful consequence to the nature so that we secure sustainable environment. But we also need to think about the environment that is friendly to human beings. The environment that does not reduce the potential of human beings to live. So the environment, in my own view, should be through how we develop, how we design, and how we construct our environment as well. Of course, it needs to be green, it needs to be circular, but it also needs to be accessible. When it is accessible, we do not to rebuild it again and again and again. And therefore, we save our energy, and therefore we save our materials for sustainable use. So universal design, which is aimed to create enabling environment for all people, will also be beneficial to the future sustainable environment. And next, BCG needs to empower people regardless of their limitation. When I say limitation, I mean people have differences. They are limited by age, they are limited by gender, they are limited by ethnicity, culture, disability, gender diversity, all kinds of these conditions, regardless of differences. And in this case, I would like to pay attention, because I'm a person with disabilities myself. The BCG needs to find all means to empower people so that they could maximize the capacity. They can develop the skills. They can improve their knowledge. They can maximize their experience and expertise to contribute to the growth and development. So these are three components that explain disability inclusion in BCG. Some of you may ask, how do we benefit out of this? I think I went back to look at the BCG model as presented by the National Science and Technology Agency of Thailand. And there's one category under BCG to accompany BCG is called silver economy. The silver economy looks at the aging society and seeks to see how development of technology, such as assistive technology, could be beneficial to the elderly or the aging people. And it could be beneficial to persons with disabilities and other vulnerable groups. I don't have any problem with silver economy. But I think aging society is one way to prove that we will have more persons with disabilities waiting for us soon. Why wait for the aging society? Look at aging society within the here and now, because we have persons with disabilities across all ages. We have persons with disabilities across all gender, ethnic identities. In the workforce, if we develop inclusive, accessible technology within the here and now, to open, to empower, to ensure access to working environment, now we will have no one to waste, because we cannot afford to waste anyone. We cannot afford to waste any time and under any circumstance. We need to look at the aging society even before it comes. And I think disability inclusion or disability inclusive BCG is the here and now long-term solution ahead of time for the aging society. No matter how limited people are perceived to be, the faith and the belief in using our capacity to develop, to create, to design, and to build inclusive and accessible environment will be for the benefit of sustainable, resilient, and peaceful society in the future. I sum up this call to those who are going to develop the BCG, and I think it's still in its early stage. It needs to be interpreted. It needs to be further developed. It needs to be further proved within the health and well-being sector, for example. If you look back to the conventional, traditional medical health system, the way in which the elderly or persons with disabilities, it happens that most persons with disabilities are within the aging population, by the way. The approach tend to be institutionalization. It relies on a lot of spending, a lot of buildings, and people are jammed into one specific area. But it would not fit within BCG approach. My observation and my proposal is through the disability inclusive BCG, the services, the medical service could happen in the community itself. It could be within the open, accessible, inclusive environment within a small community through active participation. Whether it's persons with disabilities, whether it's aging population, and those people who need any specific or specialized health care or any kinds of care could participate in all processes from the policy implementation, evaluation, and monitoring. And it would be less costly because we don't need a huge building. We don't need to have very expensive facilities being concentrated in one particular area. And chances is that the people who need services will be much happier and will likely go back and spend their lives within their family and end up contributing more to the society. So that is within the near future and the concrete, measurable solution to the health sector. So I hope that this proposal will be taken into consideration, and I await any questions and discussion after this. I'm sorry that I do not have any well-written paper. I hope you could understand from what I've been trying to communicate, and also I have one single slide that try to describe and explain what I mean inclusive equality, and how I apply this principle with the concept of disability inclusive BCG economy model, and how it could be both challenges and opportunities to the health and well-being sector within the Thai and of the society. Thank you very much.
Thank you, Senator Montien Buntan, for sharing a strong argument that the BCG economy model should be disability inclusive in order to maximize and utilize all people as productive contributors, as we have no one to waste. The principle of inclusive equality is a guiding partner of the BCG economy model to ensure that the BCG will be open, engaged, and involve full and effective participation, remove barriers, and create enabling environments for universal access to goods and services, and empower people to fullest extent regardless of their differences, especially disability. Thank you. So our next speaker comes from the medical and academic profession in the person of Dr. Orapan Puachanupun, Professor, Faculty of Medicine, Thammasat University. Professor Orapan is the President of Thai Asthma Council and Director of Center of Excellence for Allergy, Asthma and Pulmonary Diseases, Thammasat University. She developed innovations for asthmatic patients and making the network for asthma care. She received International Innovations Awards and have been invited as international speaker in many countries in the region. Her research interests have focused on the novel treatment of allergy diseases. Dr. Orapan will speak on 4 E's, a model for sustainable health. Professor Orapan, you have the floor, please.
สวัสดีค่ะ all distinguished speakers and participants. I would like to thank the organizing committee and Dr. Montip for inviting me to sharing the experience to improve health and well-being. This is an overview of my talk. I will talk about how I implement the BCG model to improve health and well-being by using my routine and responsibility work and create the herbal medicine and medical device. And also I will talk about my project working on the climate change action and sustainable model for school safety zone in northern part of Thailand. So for working for BCG model, we need to start with the problem. I start the problem from my routine and responsibility. As I'm the doctor, the teacher, and the researcher, I need to create a change from the solution to be the value creation by using the research and innovation. So what is the problem for asthmatic patient? Asthma can be fatal. And we found that 2 to 6-fold increasing asthma prevalence compared with the last 20 years from the climate change and the pollution. And 4 million Thai population have the asthma and high prevalence in Southeast Asia too. And for using the asthma medication, most of patients receive the metered dose inhaler for inhalation to improve lung function. And we found that 50% of patients use MDI correctly because it needs hand-lung coordination. For the young and the elderly people need medical device we call the spacer to improve lung deposition. But we found that only 10 to 20% of Thai people have this medical device, the spacer. And we found that for 7,000 people pass away from asthma annually from have no device and no asthma action plan. What did I do? Because of a medical device for asthma, we cannot reimburse. The patient need to pay by themselves, and it's very expensive because all medical device for asthma is an import. So I inspire the father of my patient. So she is a little young asthma. She is the have the asthma, and the father of the patient, he is an engineer, and I inspire him to work it together to create the medical device. We call the do-it-yourself spacer. Everyone can make it by themselves in everywhere and every part in the world by using reuse and recycled material. And the most important part of this medical device is the face mask and the valve. So we using the top of the bottom to be the face mask and use the 5-1 pump to be the valve. And the medical device received the exception from international innovation from the Geneva, Taiwan, and from Korea. And now we apply this is be the innovation for young children and elderly, and even the cat and the dog also have the asthma. And we train the trainer to teach the people to make the device spacer by themselves. And now we have a lot of many versions of the DIY spacer and provide free for all patients in many parts of the Thailand by collaborate with the NSTDA, SCG, and Plastic Institute. And now I transform this DIY to be the upscale, to be the industrial scale, and the people can buy by themselves with the cheaper price. And more than giving is to share the knowledge. So we developed the digital platform to teach every asthma patient to do the DIY spacer by themselves in English and Thai version too. So for the bioeconomy, so I apply how to go to the global market. The problem is we found that almost half of the population in the world have the allergy, and most of patients like OTC remedy because it's quick and effective. And most of patients are afraid of side effects from modern medicine. That's why herbal or traditional product is a very interesting. And for global allergy treatment market value, we found that the average rate increased every year, and the demand in the global allergy treatment in the year 2025 is increasing 2 times compared with 2016. That's why I interesting for working for modern herbal medicine. But to develop the modern herbal medicine, we need to validate and do a lot of research. And the most important thing, we need to target it to the what is the good candidate to be used for the herbal medicine. For the Thai, we have the ply or Singaber Kasumana plant. This is the like the queen of plant in Thailand. Mostly we use Thai for the for local use like the spa and the topical treatment, but ply have the anti-inflammatory and antihistamine effect. I'm working for ply study for the asthma and allergic rhinitis patient for more than 10 years by develop the clinical data in vitro and in vivo study, and working with the more than 30 doctor and in 8 university for work in the phase 1, phase 2, and 3. And now just finished phase 3 study, and we are ongoing to FDA submission and approval. This is how to develop the modern herbal medicine by bioeconomy. And now we have the topical cream for the eczema and shower gel too. So what is the biocircular economy strategy? So first we need to rethink around us what is the problem and focus on the problem from the patient or the big data and create the innovation and research. And we create the reuse medical device and reduce the behavioral risk factor to increase the pollution, and recycle this model by using the digital platform. We start from where we are, use what we have and do what you can for sustainable health and well-being. The factor that affected for health and well-being, not only the healthcare, the environment and lifestyle, also the main effect for health and well-being. So for take care my patient most is chronic disease, they need to take care themselves. And we have the pharmacological and non-pharmacological treatment. I developed the 4E model for sustainable health, including screening environment that trigger the allergy, and advice for how to eat properly, and exercise and emotion also affect for allergy too. And we try to make like the personalized treatment and imply the 4E's model in every patient by using the application. And we teach the patient by multiple platforms, and we have the teamwork for 4E model and the research. So 4E, 1E is the environment. Environment is quite important for the allergy. Climate change action and the air pollution also affect for the health in cardiovascular, chest, lung disease, and even in the chronic disease and increased death. So what did I do for the not only the 4E's model? I'm working with the Thai Health Organization and public Thai PBS television, and we working on the safety zone for school children in the northern part of the Thailand in the Amphali, Lamphun province. So we survey the problem in the third part of Thailand in the Lamphun. We found that in Lamphun is the fourth most burning area in Thailand and high the pollution concentration, the average PM 2.5 around 50 to 100. And in this survey, I check routine checkup and check for allergy and check for lung function and check X-ray. And we develop the safety zone school and also provide the education for primary school the children. So what we found for the health survey in the northern part, we found that most of patients have the allergy, and 13% have the abnormal lung function and also abnormal chest X-ray. What is the behavioral risk factor to increase the pollution in the northern part? Most of them are smoking and indoor cooking by biomass fuel. And people who working in the high PM area don't like to wear the mask. That's why we need to go for the education for the school children to increase awareness and teaching the students to take care of themselves and prevent for the climate change and understand how to take care of the world. So the most important thing is the literacy and health perception to understand about the health and health adaptation. So survey in Bangkok, in some area, we found that only 50% understand very well about the health, and in this low literacy increase risk of chronic disease like the DM hypertension and increase risk of hospitalization and mortality rate. So how to teach the people and the patient and my student? So I need to be the communicator doctor for health sustainable journey, because non-pharmacological treatment is very important more than the using the medical or medical care. Everyone needs to understand and take care of themselves and take care of the world who live to prevent and loss of opportunity, loss of job and loss of money or the death. So I developed the mobile application called the asthma care because of lost one patient, because of they didn't know how to take care of themselves when have the asthma. So in every asthma patient, they need to know asthma action plan. So that's why I developed the application and the multiple social media panel on the Facebook, on the Clubhouse for patient advocacy, and the event line official make like the personalized communication for all 5 generations, baby boom, X, Y, Z, and only and including the alpha, and try to make the data analysis what is the main problem for the patient. And on the World Asthma Day in the last May, I working with the influencer and the singer and the superstar to make the climate change action, the campaign and video. So lastly, for closing the gap in healthcare and well-being in my practice I think we need to putting it all together by BCG mix and increase accessibility of the medicine and medical device by using BCG model and increase awareness for health promotion and prevention and the combination in multiple platforms. Thank you so much for your attention. ขอบคุณค่ะ
Mahidol University and Doctor of Philosophy from the University of London. He is a fellow of the American College of Surgeons and a fellow of the Royal College of Surgeons of Edinburgh, among his many other achievements. His talk will be on health and well-being in the sufficiency economy philosophy and its application to biocircular clean economy model. Professor Prasid, you have the floor, please. Well, since Professor Prasid still could not connection this time, we would like to go ahead with the panel discussion session, and we will come back to him after he can make connection. So, ladies and gentlemen, we are now into panel discussion segment of the seminar. I call on Mr. Robert Dobius, former senior advisor on climate change to the Asian Development Bank or the ADB management, to serve as moderator for the panel discussion. Mr. Robert Dobius, please, you have the floor.
Thank you, Dr. Montip. So I understand that as soon as Dr. Prasit comes on, we will cut the panel discussion and allow him to come in. Let me start by saying that one of the main objectives of this seminar is, of the series actually, is to get key observations from Thai and international experts concerning the 4 sectors covered under the BCG. These will be the focus of discussion at a national conference in Bangkok later this year. The main conclusions from the conference will be summarized and provided to the government for their consideration and follow-up, and they may be included, if relevant, to the 2022 APEC Ministerial Meeting. So having said that, I'd like to start by asking each of the panel members in turn for your 2 or 3 highest priority recommendations that will ensure success in implementing the BCG in the health and well-being sector. And maybe we could start with Senator Montian, please.
Thank you. Well, I think I would like to stick with my original statement that the health and well-being sector needs to be inclusive. Inclusive means all, and we look at it from the economy model standpoint. We look at all people as productive members of the society. If we look at everyone as with potential to contribute productively to the society, the sector itself must engage and involve full and effective participation by all people. And disability is just one minute, one segment within the whole array of population that I just cite as example. The economy model as such must seek to enable people to create enabling environment. The sustainability of the environment should not be considered as a contradictory to enabling environment. So it means that we need to keep balance between being able to interfere with what's in the nature and what we can do to maximize the use of the environment so that it would be friendly, it would be universally accessible and enabling to all. And third, we need to really look at how the economy model will empower people, not dispower, not remove power from the people. So people would have to feel empowered. The health sector under BCG also needs to treat how it is constructed, how it is developed to exist within the society. So again, we have no one to waste. This is what I have to say in this seminar. Thank you.
Thank you. Could I ask Dr. Hassan, please, to respond?
Thank you. To me, it's very important to put the concept into reality on the ground. Meaning that we have also introduced the concept of CRASH, climate resilient and environmentally sustainable healthcare facilities. Yes, the health systems constitute many aspects, but one of the most practical way to move on is to make sure that the healthcare facilities themselves are climate resilient and environmentally sustainable. And this is very, very important. So this is a practical way to bring the concept into reality, both in terms of mitigation as well as also in terms of adaptation. And the next one is to make sure that we have also we know what we are talking about, meaning that we need to have the baseline information. We need to have, for example, like when we talk about water and sanitation in healthcare facilities, how many really what are the percentage or the numbers at the primary, secondary, and then tertiary level having access to basic wash, for example? It's very, very important. The same with energy and also the same with the infrastructure, so that we will be able to develop what do we want, say by the 2030, by the end of the SDG. So by this, we are putting concept into reality and measurable. We can see progress being made over times and over space. Thank you.
Thank you. And before I move to Dr. Orapan, I just want to note that I know from personal experience that she really knows what she's talking about, because I am one of those patients she was referring to in her talk. Dr. Orapan, please.
Yeah, for me, I'm no policy maker. I'm just the doctor and the teacher. I think we need to make it more simplified and visible for all people, because quite difficult to imply. Using the BCG model in daily practice is quite difficult to understand. I think make simplify and more visible and put in the course syllabus and ranking BCG to be the first priority for the research funding, something like that. Thank you.
One thing that seemed to come out of all of the discussions was that health and well-being sector generally, I'm sure, but under the BCG appears to touch on a multitude of sectors. And probably for the health and well-being sector to be successful under the BCG, that sector is also going to rely on actions in other sectors, and vice versa. Those other sectors are going to rely on what happens in the health and well-being sector. So I guess, based on either your experience in Thailand or internationally, certainly in Thailand, my experience anyway in Thailand is that the silos are very firm here between sectors, and it is not easy it seems to be a rarity to see communication crossing these silos. So I'm wondering, how do we encourage that? How do we facilitate that breaking down of these silos? Dr. Hassan talked about health and climate change. Dr. Orapan, health and communication, getting communication out. and Senator Montian, again, the whole idea of being very inclusive, and you can't be inclusive if you're only inclusive in one little area. So I'm wondering, maybe Dr. Hassan, your thoughts on that.
Robert, I think I missed the points. Would you repeat, because I was on something else just now?
Okay, I will repeat that. I think after we move to Professor Prasit, is he ready now?
Okay, sorry for a little bit late. I had some problem with the computer. So whatever, I would like to spend these 20 minutes just to provide you some ideas and what we are now doing in Thailand. May I share my slide? Right. Okay, I hope you can see my slide already, right? Right, okay, so what I'm going to share with you on the title of Health and Wellbeing in the Sufficiency Economy Philosophy and its application to BCG. You may remember that in 1997, there was an Asian financial crisis took place. I think initially partly from Thailand. And at that time, King Bhumibol Adulyadej, King Rama IX, tried to stabilize and to secure the country by introduce the so-called sufficiency economy philosophy, particularly when he mentioned this in His Majesty's birthday speech in 1998. I have to repeat it because just want to provide you, to pave you the way to finally how this provide well-being in Thailand. Sufficiency is moderation. If one is moderate in one's desires, one will have less craving. If one has less craving, one will take less advantage of others. If our nation holds this concept without being extreme or insatiable in one's desires, the world will be a happier place. And because of this SEP, the Sufficiency Economy Philosophy, I will call it SEP for short, many people try to define the SAP and they come up with a state of being that enable individuals, family, organization, or nation to enjoy at a minimum a comfortable existence, and if conditions permit, a reasonable degree of luxury that balance economics, social, environmental, and cultural conditions. If you look at information from the Western countries, most of the time when they talk about the sustainable factors that determine in the sustainability of a country, they just mention about three balance: the economy, social, and environment. But in Thailand, the King Rama IX, he added cultural aspect as well. And I remember, I could not remember exactly the year that he mentioned this, that any country that lost its own culture, the country will lose its own identity. And even finally, the country will lose its own nation. So that's why the SEP also include the balance between the economic, social, environment, and also the culture. This is the three pillars of sufficiency economy philosophy. I mentioned this beforehand because I will link this with the BCG later on: the moderation, the reasonableness, and also the risk management. The moderation means sufficiency at the level of not doing something too little or too much at the expense of oneself or others. For example, producing and consuming at a moderate level. The keyword is not doing too little or too much. Reasonableness, the decision concerning the level of sufficiency must be made rationally with consideration of the factors involved and careful anticipation of the outcome that may be expected from such action. The keyword is the rationale, and also the participation of the outcome. And finally, the risk management, which include the self-immunity, prudence, and resilience. The preparation to cope with the ensuing impact and changes in various aspects by considering the probability of future situations. So the keywords, preparation to cope with future situations. This is the main concept of the sufficiency economy philosophy. And you focus on the modulation mindset to provide the world and increasing stage global resources. The modulation try to balance between the present and the future, the necessity and the luxury, the self-deprivation and the overindulgence, the tradition and modernization, the self-reliance and the dependency. So in summary, the sufficiency economy philosophy, 3 pillars, the modulation, reasonableness, and self-immunity has to rely on the knowledge condition, which include prudence and carefulness, and also rely on the, based on the moral condition, the integrity, the religion, the patience, and the sharing. And all this move toward the balance, the stability, and the sustainability of the economy, society, environment, and culture. And now when we talk about the BCG, I think we are quite familiar ourselves with the BCG economic model. The bioeconomy, the production of renewable biological resources and the conversion of these resources into value-added products. The circular economy, reuse, recycling the resources, and also the clean economy to keep economy, society, and environment in balance, lead to the sustainability of the country. In Thailand, the BCG model capitalized the capital strength in biological diversity and also the cultural richness, and employ technology and innovation to transform the country into the value-based, innovation-driven economy. In the initial phase of this BCG model of Thailand, they focus on and try to promote for industry, the agriculture and food, the medical and wellness, the bioenergy, the biomaterial and biochemical, and lastly, the tourism and the creative economy. Just to provide more detail of the definition, the science, technology, innovation will be employed to enhance the capacity and the competitiveness of players in the value chain, upstream the raw material, for example, and the downstream and the products. In our for industry, coupling with the innovative policy and supported legal and financial measures. Just give you some example of what we have done in Thailand. The so-called the precision agriculture. I got involved with one of the project called the Nan Sandbox. Nan is the name of the province to the north of the Thailand, where they have some problem with agriculture. And then we are now trying, I asked one of my colleagues in one of the university in the northern Thailand to look into the details of the quality of the water, the quality of the soil, the temperature, and then all of this information will form the so-called precision agriculture. It will identify what kind of plant, what kind of crops that we should produce, and target to achieve or to obtain a high quality fruits. And using some technology to change the fresh fruits into the processed products. In fact, these processed agricultural products are part of the export product of the country. Likewise, when we talk about the livestock farming, in Thailand, they have used many technology to improve the quality of the livestock farming. And also in order target to provide high quality products and also move toward the processed products. When we merge the BCG together and see what happened in the, for example, in the rural area, when we talk about this BCG model, we do not mean just only the high technology, but sometimes we look back, see what we can get from the nature, and apply some natural resources in order to provide a better or a better quality products. Right in this photo, you can see the organic fertilizer, the vermicompost, and also they use the biocompost as a fertilizer. At the same time, you can use this biocompost to produce the insect larvae, as you can see in these pictures. These insect larvae, particularly the black soldier fly, it is a quality protein source for the poultry production system. So we look at the national products, transform it, try to preserve it or try to reuse it, and then move it into another step to contribute a better outcome of our agricultural and livestock industry. For the medical and wellness, Thailand looking at the herb plants, and this is an example, the Andrographis paniculata. In Thailand, we call Fathalaijon. There's some active ingredient in this herb that can be used as the therapeutic toothpaste and mouthwash. Some chemical substance in this herbal plant, it improves the healing process of the tissue. At the same time, they provide the antiviral effect. Last year, when we were in the active pandemic of the COVID-19, initially we did not have enough antiviral drugs. The favipiravir, we did not have any monopiravir like we have right now. But at that time, our research lab in the medical school showed that this Andrographic paniculata has an effect to inhibit the growth or the multiplication of the coronavirus, and we use it as the antiviral drugs, particularly in some areas where we do not have enough antiviral drug for them. This herbal substance can be used to promote the Thai herbal spa with the government support and try to convince people to move on this direction to provide a better spa. At the same time, we use the advanced technology to improve the quality of healthcare in the country. Some of them we import, of course. For example, this robotic surgical machine, but some of them we add on what already have. For example, when we use the 5G from China, and then we set up 3 or 4 startup companies comprising all Thai youngsters, and then we are now having many applications to use in healthcare and use 5G platform to complete the process. We also build up our application, for example, the AI assist diagnosis of diabetic retinopathy. This is a research from my Faculty of Medicine, Sila Hospital. We now can diagnose patients with diabetes, has some problem with their vision, and then by using this AI to diagnose what already happened in their retina that caused the problem of seeing visioning. For bioenergy, biomaterial, biochemical industry, we use a lot of organic substance to produce the gasohol, the biodiesel, the biofuels. For example, look at this coconut waste. It has been used to produce a 9.5 megawatt power station. Or in Thailand, we have a lot of sugarcane in field farm, and sugarcane can be used for food industry and also renewable bioenergy. We use a lot of this oil palm to be part of the gasohol in the country. For tourism and creative economy, we identified three standpoints of the tourism in Thailand: the cultural tourism, the nature tourism, and the gastronomy tourism. The cultural tourism, we do believe the Thai culture, particularly in, for example, in April, where they have the water festival. There's a lot of tourists who like to come to Thailand to enjoy this festival. The nature tourism, we have many places with a very scenic view. And for gastronomy, I mean the Thai food. I think most people all over the world know how delicious the Thai food is. And then they come to Thailand, some of them would like to taste it by themselves. For green economy, just only last year, 2 or 3 years ago, we start using this silent and emission-free electric ferry boats on the Chao Phraya River. Chao Phraya River is the main river of the city of the country, and then we are now having these electric ferry boats. So it reduces the pollution, and it fits with the green economy. So I would like to summarize in this last few slides. If you look at the concept of sufficiency economy philosophy, and also the BCG economic model, you can see quite clearly that, in fact, both models, they align more or less. And at the same time, it moved toward the SDG, the Sustainable Development Goals, at least 16. In fact, it involved all the 17 SDG of the United Nations, which can be classified into those related to the society and to the economy and to environment. So this just all my presentation that would like to share and learn with you all, and see what we can gain from our further discussion. I will stop my sharing.
Thank you, Dr. Prasit, for guiding us through the sufficiency economy philosophy and its linkage and synergies with the BCG economy model. I'd like to come back to the panel discussion session. Mr. Robert Dobias, please have the floor.
Okay, thank you, Dr. Montip. The organizers have asked, asked me to ask all the panel members to please turn on your cameras. So if we could continue, Dr. Hassan, I left off with you. Let me quickly go over the point I was trying to make. From each of the discussions, it seemed clear to me that the health and well-being sector is going to rely on a lot of other sectors to be successful, and vice versa. That the health and well-being sector is going to contribute either positively or otherwise to the performance of the other sectors under the BCG. So it seems to me one challenge, particularly here, is the very strong silos that are built up around each of the sectors. And I'm wondering what either from experience here in Thailand or from elsewhere, some lessons that have been learned in terms of breaking these silos down so that you have more communication and actually more action between sectors. For example, you were mentioning health and climate change. You were going from health to climate change, but I'm also thinking of things like if people are more and more hit with the knowledge that pollution is ending a lot of people's lives. Pollution is ending a lot of lives. And if we don't start getting a hand on pollution, we can expect that to get worse and worse. And we heard from Dr. Orapan about the impact that has on asthma and the deaths that are caused from asthma every year in Thailand. So, things as simple as maybe advertising climate change issues that impact health in these healthcare facilities, for example, things like that that can help break down these silos. Anyway, I've talked too long. I appreciate your thoughts on that, please.
Thank you, Robert. And when I started with the discussion about health and the climate change, it was when Paris Agreement was signed. You know that it's only one word only one mention about health itself. The entire document, only one. But then so that's how health was at the periphery. But you're talking about COP26 that was last year, that one health is almost at the not the center, but really actively discussed at the climate change discussion. Now, not only with COP, I think COP27, 28, our vision is to make sure that by COP28, it could be health is one of the center of the climate change discussion. That's that should be our dream. And if that is the global dream, that should also be the dream of at the country level. For example, like by this year, then there is no delegate to attend COP23 at the COP without health delegates. It can be health sector or even if they don't have specific representation from the health sector, there must be health chapter, or there must be health issue, health arguments at the global and also the regional meeting. So now even with COVID-19, and that's what I was bringing the two interface. There won't be any meeting of COVID or whatever that you're talking about, the economy, even at the central level without health. So there has been a lot of discussion about health in all sectors, whatever, but now health is almost central to the economic development. And that's where the issues about silos was not intentional. Silos was discussed for easy discussion, for the easy implementation of programs. So indirectly, we are working in silos. But then with this climate change coupled with epidemic, I have the feeling that health, you like it or not, is indirectly or directly is being discussed, whether in the positive or negative perspective. That's where my final intervention is to make sure that the core benefits that other sectors will bring to health is very crucial. I mean, how can you go for tourism if the tourism sector itself brings a huge impact in health and well-being, in the transport sector, in the energy sector, in the whatever sectors. So that's what Professor Orapan mentioned about the air pollution. Then whatever you do with regard to reducing air pollution through intervention with the diesel or with the air pollution with the transport sector, directly or indirectly bring co-benefits to health. This co-benefit must be promoted, must be introduced and promoted by all levels, by the policymakers right to the people on the ground. Thank you.
Let me open this up. Anyone else would anyone else like to speak?
Yeah.
That's it. Yes, please.
Yeah. I would like to invite you to join a meeting in next January. Is a Prince Meridon Award conference. So at the end of January, I mean, I'm a member of the organized group who arranged this meeting. The main theme of this meeting is the climate change, and you will. There's a lot of discussion about effect of global climate change on health, and on other areas. So also I'll include with the One Health concept as well. So would like to proceed to join. I might provide you if possible, because it's a hybrid conference. So maybe probably I can provide you some ways so that you can attend and maybe you can join the conference. It will be a big meeting and try to raise the issue of climate change on health. Yeah. So please join.
Thank you. Any other thoughts on breaking down silos, better communication between sectors?
Excuse me, this is Montian.
Please.
Can you hear me?
Yes, please go ahead.
Okay. I think towards the end of my presentation, I pointed out an example how we can achieve inclusive approach is through promotion of community-based services. And I think health sector in Thailand has already exemplified community-based approach to several health services. I mean, the health system itself has been diversified quite a bit in Thailand, and you see the role of people from ground. You see even patients and the families and the volunteers have been more actively involved in the health sector. I hate to say that the health sector has been more and more deprofessionalized. I have nothing against professional health workers, but I think we need more people to improve the health system, and I think it's a good example of how inclusion can work. Now, to break out of silo, especially in the country where the whole governance system is based on sectoral infrastructure like Thailand, for example, you need to really build, develop, and strengthen the civil society organizations, because the civil society organizations do not belong to any ministry. They work across ministries. They work across areas of the country. They work across sectors. CSOs would be the most flexible engagement of people from different fields. That's why I believe that the CSO will help make the BCG, especially in this seminar, we focus on health and well-being sector, more inclusive. Because when we talk about inclusion, we don't mean only from the supply side, we also mean the demand side. The Thai government have been tirelessly working toward integration. Unfortunately, integration is more or less melting pot approach. It does not include people of differences. So I would like to challenge us to rethink about integration and go for inclusion instead. Thank you.
How does, if I may, how does Thailand strengthen the ability of CSOs to be effective under CBD in the health and well-being sector? To you first, Senator, but also throw that open to the panel.
I think we are in the junction right now. We have two pieces of legislation. They are almost identical. There's one piece of legislation to promote and to strengthen CSOs, introduced by the civil society sectors and originally supported by the government. And there's another counter piece of legislation to control CSOs. And I hate to say that I think the latter one is harmful to the development and strengthening of CSOs. During the COVID-19 pandemic, I think CSOs have been very much working side by side and very helpful. The government alone in the silo cannot really achieve the prevention and providing healthcare services or recovery and other relief to people without collaboration with CSOs. So I think we are in the midst of kind of argument and a counter argument whether we need to do more to strengthen CSOs or to limit the role of CSOs. Thank you.
Dr. Prasit or Dr. Ropan?
Yeah. I come to the controversial issue to limit it or to promote it, the role of the CSO. Sometimes we got some advantage from the role and responsibility of CSO, but sometimes it's an obstacle. When we try to do something particular, I mean, on the, I'm a doctor. And then when we try to handle the pandemic, sometimes we got support from the CSO, but sometimes there's some, have to say there's some obstacle from them. Maybe for some, I don't know whether it's a political reason or whatever. Yeah.
Could I ask in your view, is there a horizon? Is there potential for CSOs to play a greater role under the CBG for the health and well-being sector?
I do believe there is. I do believe there is, but at the same time, we have to strengthen up the community level. So it has to be both from top down and also the bottom up. If you do it the right way, it will be beneficial without any influence from political issues. Yeah.
And who can do that? I mean, who can take the lead in something like that?
Oh, I'm not sure I can pinpoint who's going to be that, but as the academic people, we try to use academia to convince people and to make them exercise their role on the right direction. The media may be also a part of this.
Thank you. Dr. Orapan, any thoughts?
Oh, for this topic, I have no more idea.
Okay. I just saw a hand raised. I don't know, Dr. Montip, are we taking questions from participants or?
Yes, we do.
Okay, I saw the hand raised, but then it disappeared and I don't see it anywhere anymore. But maybe then we could encourage, if people have questions, please raise your hand if I see it. Or if the central switchboard, whatever it's called there, could bring them in, that would be great. But that question of participation leads me to another question, again, with the idea that the purpose of this seminar series is to try and condense down some major recommendations that we can present to the government. This sounds like a big policy issue to me, and we heard from Senator Montien that in fact it is a big policy issue. Are there any other key central policy issues that will make or break the health and well-being sector as the BCG is implemented over the coming years? I'm wondering, for example, it seems to me that the BCG in terms of health and well-being, one of the objectives is to encourage health tourism into Thailand. And if that's the case, all kinds of policy issues come up, I think. One being, how do you, in terms of the attention you give, relative attention, how much attention do you pay to health tourism versus the attention you pay to the health of the community here in Thailand? Or is there going to be benefits both ways, that both will help each other, or what? And how do you ensure that the policy environment is adequate so you can achieve both health tourism and at the same time ensure that healthcare for people in this country is improved at the same time through access to new technologies and so on.
Can I jump to this? As I'm advocating for inclusive approach, I think the health tourism, without taking the health of the grassroots community into account, will never be successful. And you cannot really achieve BCG through trickle down approach to economy. So without strengthening the community, both as recipient and contributors to the health system or to any system in the country, you need to really empower, you need to really involve, you need to really enable, create enabling environments so that they will be part of the whole growth and development. And I don't buy into generating income from health tourism and wait later on that it will be beneficial to the grassroots community in the end. I don't think it will work in that way.
Any other thoughts?
In my own opinion, I think if you want to implement any policies, the success will depend on 3 components. The first one is the policy maker. They have to be rational to make any policy. And the second one is the group who implement those policies into action. And the third one is those who to get the result from the policy. If the 3 components work together, for example, when for this health tourism, if the 3 components work together, of course, those who got good result from the policy, they have to beware of the negative side of the policy, the pollution, whatever. And so I think by working together and using the knowledge to make sure that the policy will run, keep balance between the positive side and also the negative side. I think this is in fact, this is the way that the SEP work, the sufficiency economy philosophy work. Don't jump just only on the financial result, just only to get the money, but then at the end you got a lot of pollution, and then the government has to spend a lot of money in order to improve the healthcare caused by the money get from the health tourism. I think that will not be good. Yeah.
Dr. Hassan, when you look out to the region, what policy impediments do you see out there that might be faced here with the realization that Thailand is, as we heard during the minister's presentation, that Thailand is ranked extremely high in globally, but looking out towards the region, are there policy impediments that they might be looking at in terms of the BCG going forward?
When you raise this question, Robert, I'm not, I have to be very direct. I'm not worried so much about the practicality and the possible implementation of BCG in the context of Thailand. Yes, there is a huge, probably there are some demarcation between the have and the have-nots, the poor and the rich. There are. But I think relatively, I'm not going to mention any countries because these can be quite sensitive. But compared to some countries, there's a huge demarcation. I mean, this is where the issues about vulnerability is. So I keep on emphasizing the issues about vulnerability is exacerbated or has been increased by double, triple burden of impacts or environmental determinants of health. So in the context of Thailand, I think the way I look at it, there has been quite very strong primary, the work at the primary level. I have been to many parts of, I mean, many years ago, of course, not current, to many parts of Thailand. And I've seen very practical and very good intervention at the primary health level, but there is also a huge program at the tertiary level. You will see that many other countries, not in the region, but many other countries itself, you would see that they are not only women, they are poor, they also live in the highly extremely polluted environment. They're also vulnerable to climate change impacts, both in short and long term. They don't have even access to water and sanitation, basic like water. This is basic human right issue. So directly, Robert, if you ask me, I mean, this is also, in fact, Thailand probably score better than my own country, like Malaysia, because I'm from Malaysia. We have been in the same path like what Thailand has been. But then because of COVID, because of other aspects, then this is the gap is becoming relatively wide. But there are many more countries that has been the what do you call it, the differential between the do's and the haves and the have not is critical. And this is where I my emphasis when I say vulnerability, double, triple burden of disease. And this will make things worse, because if you are rich, for example, I mean, you have first, you stay in a better place. You don't drive you don't work and drive in the polluted air because you are in the aircon and a few others as well. So, but you have also the other end of the society that you are exposed to many of these environmental, social impacts itself. So I'm coming quite controversial here, but I think this is reality. Thank you.
Dr. Sai, I saw you're being called away, but before you go, could I ask you a very quick response to, I haven't seen much discussion in the literature about financing the BCG. Now, I know a lot of that will come from various places, but in your position with WHO, I know WHO isn't a financing agency, but you undoubtedly have an idea about international sources of finance in the health and well-being sector. And are there any sources of finance that Thailand might be looking toward internationally?
You are right, Robert, that WHO, when it comes to this, relatively not so strong, but I have seen more serious efforts and putting figures into, I'm talking about both short and long-term economic figures into not only the impacts and also the program itself. There has been a discussion about the economic impacts of air pollution, even the economic impacts of the impacts of climate change on health, and also in terms of water and sanitation. What will be the economic cost when it comes to not access to basic services like water and sanitation? But I have not seen yet the economic evaluation of the policy in complete policy intervention. So maybe I'm wrong, because I'm not a practicing economist, although my doctorate is in environmental economics, but maybe I'm wrong, Robert. So my apology if I missed that. I have seen some sectoral evaluation, like water sanitation when it comes to climate change, and then even COVID-19, and then air pollution. I think there has been a lot of argument about both the economic impacts and the economic values of air pollution impacts and intervention of air pollution work. Thank you.
All right, thank you very much. Are there any other thoughts? I was thinking more specifically in terms of financing for innovation, financing the technical overhaul that's going to be needed in some areas. Are there any thoughts on that? Okay, I guess financing, maybe nothing is written about financing because nobody is worried about financing that, and that could be the case. Maybe, you know, Thailand is certainly not, Thailand of today is not the Thailand of 30 years ago, 40 years ago when I first came here. I noticed Dr. Suwaji mentions that the health profession in Thailand is exceptional, and people participation and societal engagement is strong through a series of health assemblies. Is this a vehicle to bring this down, bring the BCG down to the ground level in the health and well-being sector?
Hello, Bob.
Yeah.
This is Mario here. Can I join the discussion?
Please.
Yeah, I was just listening to the very interesting panel discussion. I could gather 4 points that I would like to contribute in terms of policy issues that could be part of the recommendation. We talked earlier about the interlinkages between sectors, that health and well-being sector is not isolated with the other sectors. There are relationships. So it might be a good policy to treat health and well-being as an enabler, like education. We look at education as enabler to all the sectors, because without it, then the other sectors would be handicapped. So it might be a good policy recommendation to treat the BCG, health and well-being, as an enabler to all other sectors as well. The second point is about local communities, because when we look at SDGs, the action is really on the ground. It's from global to national to local. So we could also localize the BCGs. If you localize the BCGs, and that includes health and well-being sector, which would become community-based, that could be a second point. And the third one is about equity and inclusion, which is really promoting no one left behind in society, because waste is not only materials, but also people. We should utilize each and every citizen. And the fourth one maybe is information availability, because people are not aware of what BCG is. So if there is a policy related to enhancement and dissemination of information available, that might be a good way to move forward to advance BCG's implementation. So that I could contribute. Thank you.
Okay, well, I think we're running up to time in the panel. I had just one point. If it were up to me, I would take Senator Montian's one slide and slap it right on the cover of the BCG report, whatever that might be. In that one slide, it seems to me, talk about some very fundamental things of fully effective participation, empowerment, accessibility, equality, inclusive equality, and freedom of choice, non-discrimination. There's so many issues here in this one slide. At any rate, I think there are a lot of things that we learned from this discussion. I'd like to thank each of the panel members for their contributions. Dr. Montip?
Thank you very much. I think we have come to the end of the seminar. It was a very productive seminar with valuable information shared and discussed by our speakers. In this seminar, we focus on the health well-being sector for implementing the BCG economy model. The process of implementation would entail building capacities of human resources to be conversant and skillful of the BCG economy methodology and practice. This would require investments in science, technology, research, and innovation, especially in the health and well-being sector. Learning for sustainable development at all levels is an important infrastructure for transformation, raising awareness, building capacities, and learning international perspective on BCG economy model at local, national, regional, and global forums are essential. And the role of the United Nations through its various agencies such as WHO and others, as well as other international and non-government organizations, academia, and the private sector are essential in upscaling projects to the national level sharing of best practices and policies. We aim at taking lessons from this seminar and provide recommendations to authorities, policymakers on the challenges, opportunities, and advancing implementation of BCG economy model in the health and well-being sector, and provide possible inputs to the upcoming APEC summit hosted by Thailand in November this year. We will continue our discussion in this seminar series. The next seminar to be held in the latter part of this coming month, which is the third in the series, will focus on BCG economy model in the bioenergy, biomaterial, and biochemical sectors. So keep posted. So we conclude the second seminar. We appreciate your participation and we look forward to seeing you again soon. Thank you very much. All the best and stay safe. สวัสดีค่ะ